Dr. Frank Staggers spent a lifetime breaking down barriers and building communities. He believed deeply that the communities we come from have a lasting impact on the individuals we become.
Frank was, as you've heard from probably everyone you interview, a very special person who had a personality that when he walked into a room, he took it over.
Well, Frank was a no-nonsense guy. There wasn't much about him that was subtle. If he had a message to deliver or a request to make, it came right out.
He was a physician who, and I don't mind using this term, who exuded love for his patients and the community that he served.
As one of 9 children, the idea of community came naturally for Frank. While his parents did not have the luxury of pursuing an education, they had high expectations for their children so that they could achieve the success and equality they had not known in their own lives.
My father was shaped by being poor when he grew up. You know, he picked cotton, he picked tobacco in the fields to basically support himself and much of his family.
His father worked as a railroad switchman. And Frank learned wisdom because he was the middle sibling. And so he said he had to get along with the older siblings and the younger siblings. And so he had to learn how to negotiate to survive.
I can remember when I graduated from high school, he bought me a car. So we have a person that went from picking cotton and picking tobacco to being able to buy his son a car when his son graduated from high school.
All 9 of the Staggers children graduated from college. After serving in the Army during World War II, Frank returned home to complete his medical training and then enlisted in the Navy, becoming one of the first African Americans to earn a naval surgical residency.
He had grown up at a time that the United States was very segregated. The Army was segregated during World War II. And when he went into the Navy, he was, I think, like the 2nd or 3rd black resident that the Navy had ever seen. And so he had a lot of prejudice just being a naval officer. But he told me that he was able to see differences in the years that he spent in the Army and the years that he spent in the Navy. He was able to see differences in the services in general. And I think that when he left the Navy, he really felt that it was an experience that he really enjoyed.
The Navy, Frank often said, showed him the value of organized medicine and serving large communities. When he retired as a captain, Frank could have had his pick of projects or positions, but chose to remain in Oakland and serve a community so much in need of healthcare and education.
One of the things that I remember most about Frank was his concern about the health status, particularly about kids in Oakland.
You know, Oakland is a very diverse community and has a large black population. And, you know, I think when he started, there was still discrimination. There's a certain degree of racism. It's just there. He was able to make a difference for others and make a big difference in the community. So that's how he became the leader.
Bringing together his personal history, military and medical training, Frank's natural skills as a leader began to take root. He became a man with a talent for advancing great causes, and a second career of sorts had begun.
Well, you can only touch so many people with your stethoscope. You know, if you really want to make a difference in medicine, at some point, and this is true of almost any doctor, at some point you have to address medical policy. And so my father realized that. He realized that yes, it's important to be a good clinician, but if you can affect medical policy, then do that, because medical policy will affect thousands of people, if not millions of people. The decisions that the CMA makes, the decisions that any medical organization makes or association makes, has widespread ramifications, not just for the doctors, but for patients too.
Among the many organizations Frank led during his career, his work as president of the CMA, president of the Alameda Contra Costa Medical Association, and his work with the CMA Foundation allowed him to have a larger impact than would ever have been possible in his solo practice. As a social, political, and professional leader, he sounded the cry on issues including prostate cancer, asthma, hypertension, obesity, and type 2 diabetes. Eventually, Frank realized the most effective way to address the disparities in healthcare was to reach out to ethnic physicians working in underserved communities. He and his mentor, Dr. Roland Lowe, drove up and down the state meeting one-on-one, building trust with those doctors.
We went around Southern California on weekends to visit the various ethnic minority physicians in their natural habitat, shall we say. So be it Asian or Black or Hispanic board meeting, we go there, introduce ourselves, and told them why we think the ethnic minority organizations need to join hands and be a stronger voice in organized medicine. It was our commitment, and I think that's how NEPO was formed.
If you look at all the men and women that participate in NEPO, and you look at what they stand for, reduction of healthcare disparities, getting more minorities into medicine, getting more women into medicine, those were things that my father really believed in. So it was a perfect fit, it was a perfect marriage.
Frank was probably the most articulate spokesperson and representative for the new California in the practice of medicine, ethnic physicians, ethnic communities.
I think that organizations like NEPO are addressing things like that now, trying to say we don't need people dying of preventable causes, especially if you look at minority communities or communities of poverty. We're too rich of a nation to have the healthcare disparities that we have and people dying of chronic diseases. We can do better, and I think we're trying to do better. And tying that back to NEPO, NEPO is trying to do that.
Of course, Dr. Frank Staggers will be most poignantly remembered as a man who brought about change for whole communities of people by inspiring them one at a time.
There was just something very special about him. He was just really inspiring, even for those of us who didn't have as long as we would have liked to know him and spend time with him.
What people believe is not so much what you say, but what you do and how you live your life and how you treat people. And Dr. Staggers was an incredible person and treated each one of us like we were more precious than gold.
Frank taught me to care more about other people than you care about yourself. He also taught me that you're measured not by your wealth or by a lot of other materialistic standards or even titles. You're measured by what difference you make while you're here.
I remember being in an event with Dr. Staggers, and it was an event honoring him. And still, as a new CMA staffer, he came over and he sat down with me and talked about what it means to him to be a physician. And I remember thinking, this is why I want to work for doctors. This is what is inspiring about the work that they do.
I think Frank put a very strong human face on physician leadership in the state of California. He helped humanize the profession of the practice of medicine.
What was most remarkable to me is that he inspired people to do good, and he inspired people who didn't know each other, who came from many different walks of life, to do things.
I think that Frank was one of those good people who did more than most, did more than a lot.
He taught me a great deal. I just could miss him.
He was just a great individual. I was very, very proud to be his son. I really couldn't have asked for a better father.
I don't know whether you saw The Gladiator, but The Gladiator was a film, and these gladiators were in the arena, and they were going to be facing an unknown enemy coming out the gates. And I can remember the lead actor saying, "I don't know what's going to be coming out of those gates, but I know one thing: we will be much better off if we are together. If we are together." And that's always rang a bell with me. And I think that's been the catchword of the foundation. We'll be much better off if we are together.